Hi, I'm Tim Allardyce and I'm the Clinical Director of Surrey Physio. It's a huge pleasure to welcome you to the Surrey Physio Group. We are a brilliant bunch of experienced, well-trained and just really nice physios. I'm so proud of my team and I'm really proud of our amazing group of physio clinics. So let's tell you a little bit more about Surrey Physio. I set up the group in 2005 and here it is today. We have an amazing group of about 40 physios who deliver outstanding care to the communities where we live and work. Our ethos is very much about delivering high quality care and great communication. And you know what? We work hard, but we love to have fun. We always deliver good care. We're not a low quality provider, we're a quality provider, and our guys are really, really well trained. Let's talk about some expectations from our side. So bear in mind that our physios are giving up their time to help you, and that's quite a difficult task, especially in the current climate. We're sharing our expertise and our knowledge with you. Now, we're not your headmaster and we're not your teacher, so we're not going to tell you what to do. Ultimately, the placement is up to you. It's what you put into it and what you make it. If you want to put loads of effort in and have a great time, fantastic. If you're not having a great time, then probably we'll just end up parting company. We provide a supportive environment where you can learn. If we can't provide a day for you, we might say tomorrow you can work from home or do some training. We've got training manuals, courses. We've got loads of training we can do with you. So we are here to support you and to provide education for you and to try and help you become a great physio. And I hope you really have an enjoyable experience working at Surrey Physio. We've taken on physios quite a lot over the years, so we've had quite a few, and we're planning to take on even more. Why do we do that? Well, I think it's just great to give back to students. You know, we've all been students at some point in our lives, and it's just really nice to give back to the universities to offer something back to the students. As well, you know, we have hired students as well and offered them jobs, and that's been useful. And sometimes we even get them doing tasks. You know, some of the things we might ask you to do, cleaning and wiping down tables and disinfecting, and we've all got to pick up the phone and do some admin. We've got to do reports, so we'll ask you to do it as well. We treat patients and we do telephone calls and video calls, and we give exercise plans and we do manual therapy, we do electrotherapy. You know, we don't just believe that physio is about exercises. We believe that there's also the element of nutritional advice and fitness advice and support and manual therapy and electrotherapy or acupuncture and anything that we think we've got. It's like having a big toolbox, and we're going to use these tools to help our patients get better. So you're going to see, very likely, you're going to see a wide range of tools and treatments used to help patients. We really expect you to come up with a good attitude. No jeans, dress smartly, dress appropriately, be professional, ask questions is fine. You know, get yourself involved in a treatment plan, type notes, and you know, also if you're having a good experience, tweet about it, share it on social media. You know, it's good promotion for us as well, and if you can tag Surrey Physio and use us and mention us on Twitter and Instagram, take photos is fine. Obviously, if there's any patient identifiable information, you need to make it confidential or get written permission before you post it. But you know, if it's just around the physios, you know, feel free to share stuff on social media and mention to people that you're having a great time at Surrey Physio. Bring your own lunch each day. So we obviously don't provide lunch, but you can go out to the shops and bring it. If you need to take a break during the day, it's no problem. Just go and take a break. If you've got assignments you need to do, you need a couple of hours off to go and do some uni work, It's no problem, just go and find a spare room and go and do it. You know, you don't have to spend the whole time with patients. It's designed to work around your needs and to be flexible. So we identify what you need to get out of it, and then we'll try and provide that. Also, try and do as much of your own paperwork as possible. You know, it makes our life easier. If you can prepare the paperwork, we'll just write the sections we need to do and sign it off. So prepare as much of the learning needs as possible that you have. What will your placement involve? Well, you know what, there's lots of different routes that we may take. So some of the things we're involved in, we do a lot of first contact practitioner work in areas like North East Hampshire and Wandsworth and Croydon and Lambeth. So we might assign you to a first contact practitioner. If you're doing, you might end up in private practice. So you might be shadowing a physio, supporting that physio. We'll probably ask you to do things like ultrasound or shockwave or laser on a patient. We might ask you to write up notes, and we'll definitely ask you to prescribe exercise plans, and we'll come on to that in a minute. And the other thing, you might be in a clinic where we treat NHS patients, and that'll be usually manual therapy or video and telephone calls, and we'll be providing hands-on treatment or advice, guidance and exercises. And if you're doing really, really well, we actually may open you up with your own patient list. Now, we may just specify what we want you to do during those lists, or we may give you full autonomy to do as you please. You'll always be supervised, there will always be a physio on site, and you know we'll make sure that the patients are appropriate for you. But it depends on your level, where you're at with your training, what year you're in, whether you're doing a master's or a bachelor's, and what your previous experiences is. You know, some of you may have experience with sports massage and sports rehabilitation, and so naturally feel more comfortable to see patients, and others may not. So we'll really work with you and work out what your needs are, what your goals are, what your experience is, and then try and make it as appropriate as possible. But we're also welcome for feedback. So anytime you feel that you want to step up to the next level, just let us know. So we'll assign you to a physio that will look after you during the duration of the experience, or it may even be two physios. So one physio might look after you for the first week or 2 weeks, and then another physio might take over to give you a bit of varied experience. Now, exercise prescriptions. So we will ask you to prescribe exercises to patients. We'll help you at first, but then we'd expect you to get to know it. We use an amazing exercise prescription software called Rehab My Patient, which is www.rehabmypatient.com. It's brilliant. It's been a lifesaver for us, and we've got, you know, something like 100 GP locations registered on our Rehab My Patient account, and we will add you to Rehab My Patient as well as a practitioner, so you can prescribe exercises to your patients, and it just makes life so much easier. So I think you'll really enjoy that, and we'll show you how it works. You'll be working alongside a physiotherapist. They will be with patients or doing telephone calls or video calls, so you'll be shadowing them, and you'll be supporting that physio. When you're ready to undertake your own caseload, then we can move you up to that level. So common injuries we typically see, well, we see loads of neck and back pains, lots and lots and lots. That's the majority of our work. And then the next most common injury we see would be shoulder pain, followed by knee pain. But actually we might see anything in the body. Now, in first contact practitioners in primary care, literally anything could come in. Of course, it's mostly going to be musculoskeletal, but we do see other things. And you know, I was doing an FCP clinic a few weeks ago, and a patient came in with a toenail problem. In actual fact, I could help that patient, and I gave her some advice and told her how to sort it out. You know, and it's not necessarily musculoskeletal, although most of them will be musculoskeletal patients. But you might see some neuro, you might see some paediatrics. I'd say about 95% would be musculoskeletal. We have lots of equipment at the main clinics. So we have typically shockwave, ultrasound machines and lasers at the main clinics, and we also use acupuncture at the main clinics. At the GP surgeries, we don't have much equipment at all. We really just utilise exercise prescription advice, and we have a treatment table for any manual therapy or examinations. Your You have a start at probably 8 AM or 9 AM and will carry on till 4 or 5 PM. It's not set in stone though, because depending on where we place you, who we place you with, we've got to also work around their diary, we've got to work around the particular GP practice where we may place you or the clinic, and they've all got different opening and closing times. So it might be you do a really, really long day, but you might get a day off in the week. You know, we'll work with you to work out where's the best place for you based on your location, based on our availability, based on other students that are in, based on the physiotherapist and their commitments. And we'll try and fit you in as best we can, but typically you start at 8 or 9 AM and finish at 4 or 5. Some amazing experiences ranging from 4 Olympic Games to Commonwealth Games to European Games to World Indoor and Outdoor Athletics and Swimming Games. We've represented at London Marathons. We have been redeployed and supported hospitals, NHS trusts and primary care during COVID. We have supported local communities with community groups and events. So we've worked right from the very highest end of physiotherapy and elite sport to right back down to bare communities. And so we've got a real wealth of experience and knowledge within our group. So I hope you've experienced and welcome on board to the Surrey Physio team.